Mr. Jones. I know you've been diagnosed with hypertension, and today we are going to talk more about what that means. So hypertension is also known as high blood pressure. What blood pressure is the pressure that is pressing against your arteries as the blood pumps through. There's a few different types of hypertension. So we're going to talk about a few different types. Primary hypertension is also called essential hypertension, and that is when there's no true identifiable cause. Really, there is a few different systems involved that try and control the blood pressure. And really, there's cardiac output and something called peripheral vascular resistance. So cardiac output is the amount of blood that your heart pumps each minute, and the peripheral vascular resistance is the resistance from the body, from the blood vessels, when the blood vessels constrict. So basically, that is the system that controls your blood pressure back and forth. So as the cardiac output increases, or as the peripheral vascular resistance increases, or blood volume increases, so does your blood pressure. So that is one system that could be involved in essential hypertension or primary hypertension. There's also something called secondary hypertension, and that is when the high blood pressure is caused by a secondary medical condition. That could be caused by renal disease, or a common one is gestational diabetes, when your blood pressure is high during pregnancy. One system that could be involved in secondary hypertension is the Renin-Angiotensin System, and that system involves the kidneys, and basically boiled down, it takes sodium in water and retains sodium in water, and in turn that raises your blood pressure. So one other type of hypertension that we are going to talk about is complicated hypertension, which is also known as malignant hypertension, or people also call it a hypertensive emergency. That is a high blood pressure that develops rapidly and can cause, it usually causes some type of organ damage. Typically, a person with malignant hypertension or complicated hypertension is seen with blood pressure usually like 180 over 120. Hopefully you'll never have that, but I know you have a history of hypertension, as well as a personal history of uncontrolled hypertension. For you, Mr. Jones, it's critical that you get this under control. I know you've put on about 20 pounds in weight, and that can lead to your blood pressure becoming increased. So that would also explain your shortness of breath during activity. Your sodium intake is important, like we talked about. Your sodium intake, as your body takes in sodium, your body also has to retain water to balance out that sodium, and in turn your blood pressure increases. Drinking alcohol also increases your blood pressure, and I know you have about like 5 drinks per day or per week, so that also can increase your blood pressure. So the biggest risk factor for stroke is actually prolonged hypertension. It's the number one risk factor. So when there's excess pressure on the vessels due to hypertension, the vessels become damaged, they become stiff and narrow, and then clots begin to form and they travel to the brain, and that blocks off the arteries, and that's called an ischemic stroke. That's when the brain is not being perfused, it's not getting enough blood. So that is one type of stroke that high blood pressure can lead to. The other type of stroke that high blood pressure can cause is a hemorrhagic stroke, and that is usually caused through bursting of an aneurysm. And what an aneurysm is a weakened blood vessel. So basically, the weakened blood vessel, the high blood pressure basically causes the aneurysm to burst, and then the vessel then bleeds out, and then your brain doesn't get the blood and the oxygen that it needs. So not to scare you, not to worry, but it is preventable, and the stroke is preventable by getting your blood pressure under control. The main thing is getting your lifestyle changes today, and that includes reducing the amount of alcohol, exercising regularly, reducing the sodium intake, and improving your blood pressure. You've already quit smoking, you can do it. Your doctor may also put you on blood pressure medication, and it's important that you take that as directed. Checking your blood pressure every day is also crucial. Some doctors may even have you take a low-dose aspirin as a preventative blood thinner to help prevent a stroke. So no matter what your doctor prescribes, just make sure that you take it as prescribed, and also do those lifestyle changes that we talked about, and you should not have any problems, and just continue to talk to your doctor about any issues that you have, and you will do great. Thanks. Bye.